Good evening, everyone, and welcome to tonight's virtual town hall with Congressman John Larson. I see that folks are starting to join both on Zoom and Facebook Live. So before we begin, as a reminder, if you have a question for the congressman, you can put your name and town in the Q&A section with your question, and our team will review it and try to get to as many questions as we can. If you're on Facebook Live, you can add your question in the comment section with your name and your town. Um, Without further ado, if we are ready to begin, I will turn it over to Congressman Larson.
Well, thank you, Charles, and thank everyone for joining us again. We think it's vitally important that we stay in touch with our constituents, and never more important than this day and age, especially in lieu of what happens almost every day, day being no exception either. I apologize that we were running a little late coming from one event to the other, but wanted to make sure that as we have in a number of the forums that we've been conducting in town halls, that we're here to try to explain to people what's going on with regard to the government shutdown, and then also take your questions and concerns that you might have. And I usually like to start by saying uh, just what's going on so that people to try to settle people something, but it's hard with this president who every day does something that will only further send my blood pressure through the roof, but also has little regard for the Constitution. In fact, I think it's safe to say that the president regards the Constitution more as a suggestion and not the law of the land that he has to follow. And his latest actions just late this afternoon in going after the Attorney General of New York only add to a list of grievances that he continues to perpetuate, again, feeling that he's above the law and not the president of the United States, but does so in authoritarian like manner because he believes and is consumed by his ego and by wanting to grab as much power as he possibly can to let everyone know that he's in charge. That's not the way a democracy works. And that's part of the reason that we're in this shutdown. As you're aware, the Republicans control the presidency, the executive branch, and they control both the House and the Senate. So therefore, if they wanted to keep government open, they're the majority party and have a majority of the votes and can vote to keep government open. But they instead are blaming the Democrats and saying that they need Democratic votes. Well, Democrats are happy to give them the vote. We want to see government open, but we want to see it open with people having their health care intact and not 16 million people losing their health care and another millions of people seeing their prices rise dramatically. And for what purpose? So that Donald Trump can provide the billionaire class with yet another tax break, something they weren't even asking for, and something that I believe even billionaires are embarrassed that this is how he's going about this and what it means for the economy and what it does to people and individuals. But suffice it to say that we're ready and prepared to vote to open government, but we're also ready and prepared to stand and fight for people being thrown off of their health care insurance. And for those that are fortunate enough to stay on, to see their prices double and triple. That's going to have an impact on everyone. And going around and talking to our hospitals in the region and healthcare providers, they're all saying the same thing, that this is going to be chaotic and it's going to hurt everyone, not just the people that are being removed, because we have something called uncompensated care, which means that people who no longer have health care when there's a health crisis are going to rely on the emergency room. And hospitals are required by law to make sure that they service people. They're also, talking to Jeff Flax, and many healthcare leaders are saying they also do it out of sheer humanitarian purposes as well, to make sure that you're not turning away the very sick. But that exacerbates problems and prices for everyone. That's what this shutdown of government is all about. And that's why we've had people testify, especially from the private sector. Again, this notion that the reason that Democrats are holding out is to give immigrants who are here illegally health care is an absolute falsehood. It's a flat out lie. There's no other way to put it. But this administration, uh, you know, lying has become part of their nomenclature. They do this routinely. And to hear Speaker Johnson, who knows full well that this is not the case, they know what the law is, and that whether it's Social Security or Medicare or Medicaid, no undocumented worker, no United States citizen, no person who's not a United States citizen can receive these benefits. And we'll continue to make that point. And as I think the American people become aware, and then also aware of what is the rationale behind taking people's insurance away from them and raising their costs for so that billionaires can have a tax break? Nobody agrees with that. So first and foremost, what we want to do is make sure that if you have an issue or a problem in getting through to anyone, and even though vital agencies will remain open, they're understaffed. As an example, there were already 7,000 layoffs on Social Security before the shutdown. And they were closing regional offices, not fixing the phone services. And these are the kinds of things that cause backups, delays, and the lack of the ability to pick up the phone or go to an office and actually talk to another human being instead of a computer or to someone that's simply not there. So if you have a problem, we highly recommend that for our constituents, and I know all the other members of the Connecticut delegation agree, call our offices. Our number is 860-278-8888. That's 860-278-8888. And we want to make sure that people are aware that about the federal agencies that are open. And let's start, with even though many federal offices have furloughed staff dedicated to responding to congressional offices, and as a result, progress may be slowed or paused during the shutdown. Let us try our very best to work with you to help you instead of having people continually frustrated by this process. What people want to know basically is, will I continue to receive my Social Security benefits? Yes, absolutely. Beneficiaries will continue to receive their Social Security and SSI benefit payments. Most services at the Social Security Administrative Services, SSA, will continue, including processing applications for new benefits, and issuing Social Security cards. Some services, including benefit verifications, have been halted. But overall, again, if there's an issue and a problem, please call our office and we will assist you. Clearly, Medicare and Medicaid, or in Connecticut known as the Husky program or Affordable Care Act coverage, will it be disrupted? No. Medicare and the Affordable Care Act coverage is not impacted by the shutdown. Medicaid Husky benefits will continue as normal unless the shutdown continues past January of 2026. Will my mail still arrive? The answer is yes. The Postal Service is not affected by the touchdown. Will passports and visas still be issued? Yes. Consular services, passport services, and visa services are continuing during the government shutdown. Passport acceptances located in buildings operated by the agency that is shut down may not be open, but most sites are unaffected. If the shutdown is prolonged, passport and visa issuance could be delayed. How will the federal workforce be impacted? Well, during the government shutdown, many federal workers are furloughed. All federal workers, regardless of furlough status, will go without pay for the duration of the shutdown, including an estimated 10,464 workers here in Connecticut. Now, they'll receive back pay for this, but the Government Employee Fair Treatment Act, signed into law in 2019, guarantees that furloughed government employees will receive that back pay once the shutdown begins or ends, excuse me. However, impacted federal contractors are not guaranteed back pay, and military and federal retirees will continue to receive their retirement benefits. Processing new applications or other requested changes can be delayed. What is the impact on the food assistance program, commonly known and referred to as SNAP? Benefits will not be affected unless the shutdown lasts longer than a month. And air traffic control and travel, of course, through the Transportation Security Administration, TSA, will continue working to make sure that flights are operated safely and continue to occur, although travelers should monitor their airports because of delays which have been reported. And again, in all cases, if you have a question, please call our office as well. Now, I also want to commend Rosa DeLauro, who is leading the effort from New Haven, Connecticut, who's the ranking Democrat on appropriations, who's leading the effort to put forward the plan supported by every member of the House and Senate to keep government open and reverse Trump's devastating cuts to healthcare. These are just practical concerns, and common sense would dictate that they be met. Republicans have been nowhere to be found. They skipped town after Donald Trump told them not even to bother to negotiate with the Democrats. And while the Senate has come back, Speaker Johnson has not reconvened the House. We were there all last week, and Johnson and the Republicans did not show up. They said they were coming back this week, and they have not showed up as well. Democrats stand by and ready to come in and vote at a moment's notice on what will restore the health care benefits to people and also keep the government open and functioning. So just to give you an idea of the ramifications of this, 15 million Americans will lose health care, including 167,000 people in Connecticut, 37,000 in the first congressional district. That's simply unacceptable and cannot stand. And that's why we're fighting this. That's why we believe that this is the right thing to do. And now the Affordable Care Act tax credits for 20 million Americans are expiring. And that means 19,000 people in the state of Connecticut and 19,000 in the first district and 112,000 in the state are going to find their tax credits being diminished. That's why we're fighting. If these tax credits expire, the 19,000 residents in our district will see skyrocketing costs. And there's no need for this. It's not necessary, especially during these inflationary times when the talk across the kitchen table is about cost of living and what we need just to get by. We should be assisting and helping working class Americans, not exacerbating the problem as this will by loss of insurance and compounding the problems of healthcare in our hospitals and healthcare facilities and long-term care facilities as well. An average family of four in the state of Connecticut could see costs rise by $2,571. And a 60-year-old couple could see nearly 25,000 in costs increase. That's, again, unacceptable. The American people can't afford the Republican healthcare crisis. And when did you think I would be aligned with Marjorie Taylor Greene, who has said, broke with her own party and called out Republican leadership for having no plan on healthcare? It's not every day that I find myself on the same page as Marjorie Taylor Greene, but she's right. And we have to take action to prevent costs from rising, and Republicans have no answer. And so, with that, let me throw it open to questions that you might have so that we can get to, I think, the reason why most people tune in, so that there's an opportunity to discuss this issue. So,
Thank you.
Charles, are we ready?
Yes, thank you, Congressman. We're getting a lot of questions about the government shutdown and also on another issue that you touched on earlier. And on that, Jeff from Bristol asks, why is Trump deploying National Guard troops to fight crime instead of directing more funding to local police departments?
Well, that's a great question, Jeff, and you're absolutely right. That's where the funding should be directed to local police departments, local state and municipal police offices is where this money should be sent. What Donald Trump is doing here is trying to militarize the United States government, to let everyone know that, as I said earlier, he's consumed with his own ego and own power grab and is insisting on sending, and it's no coincidence that he's sending these troops into cities that are run by Democratic mayors and states that have Democratic governors. It is such a breach of power that Americans should be outraged by this and continue to speak up, as we will, in the United States Congress. And I believe that he's on the border. And today, again, with calling for further militarization, for what purpose? What purpose did he bring back all the generals from around the world, the military leaders of our American troops here at home, and saying that we have to deal with the enemy from within? The enemy from within, meaning fellow American citizens, people that are peacefully protesting. This is a man who's consumed with his own power, and some argue has some very serious problems going on in terms of his mental capacity. I think Congress is going to have to look at all of these, but this is flat out wrong and not the way the government of the United States operates. This president and this Secretary of Defense are way out of line. Hopefully, our Republican colleagues in a separate branch of government will stand up to this dictatorial and authoritarian abuse that this president is demonstrating.
Next question comes from William in Newington, and he asks, will our troops and air traffic controllers be paid?
Well, the answer is yes, they will ultimately be paid. Uh, and we're going to make sure that we hold them to it, but they shouldn't have to be going through this. They shouldn't have to endure this. And not only them and their families and the uncertainty and what this does to the economy and the overall fear and chaos that this creates. Let us hope that our Republican colleagues bring the president to his senses. The Both Senator Murphy and Senator Blumenthal are in Washington arguing with the Senate currently and holding the line on restoring the health care benefits and saying this is a simple decision for people. And the irony is that more red states, meaning more states that are Republican in nature, are hurt more, their citizens and individuals, by losing their health care benefits than in blue states. And so President Trump is at war not only with Democrats, but his own party. In fact, he's at war with the American people. Also, he can provide billionaires like himself with a tax cut. Listen, I think all of you know this. Donald Trump has never had to worry where his next meal was coming from. Donald Trump has never had to worry about paying a mortgage or paying rent or how he's going to get kids through school. Donald Trump has never had to worry about any of those and is out of touch. And the only thing he worries about is further lining his own wallets and those billionaires that benefit from the tax breaks that he has proposed that are wreaking havoc on this nation and the working class of our country.
Our next question comes from Gina in Glastonbury, and she asks, why are the Democrats insisting on giving illegal immigrants free health care when U.S. citizens have to pay?
Well, I'm glad you brought that up again. This has been debunked by Political Fact, by CNN, the Associated Press, the New York Times. We've had the people from Access Health and Hartford professionals that are not associated with politics, et cetera, come in and say this is an absolute lie. They do not receive these benefits. And if you are not an American citizen, you cannot receive these benefits. It's a total lie manufactured by this administration to rile the American people, to seek to divide us, to do so by creating fear, as they do with people draped in black masks and armed with guns, tearing mothers away from their children. This is not the America that we grew up in. And I'm glad that you asked the question because it's being debunked by every major authority that knows, of course, that this is totally untrue and false.
Our next question comes from Adam in Hartford, and he asks, why are Senate Democrats keeping government closed?
Well, they're not keeping government closed, as a matter of fact. As I said in my opening statement, um, the Republicans control the Senate, they control the House, and they control the presidency. And the Senate has a rule, though. It's called cloture vote. And that rule is passed by a simple majority. Well, who has the majority in the Senate? The Republicans. And so they could easily say we're suspending the cloture vote and pass with a simple majority. So the question becomes, why aren't they? And why are they blaming the Democrats? Well, because the Democrats have fought tooth and nail about what's happening to the American people and the people being thrown off of their health care and the others that are going to see their health care costs rise dramatically. If you're not going to stand up for people's basic needs and essentials, why are you in the United States Congress? Who are you there to represent? The billionaires who get the tax break, or the people who all they're asking for is the health care that they receive from their government that they pay for? And they're making it far more expensive for those who still are able to remain in the plan and eliminating it for 15 million of our fellow Americans. It's flat out wrong. And that's why Democrats are standing up and speaking out against it. I commend both Senator Blumenthal and Senator Murphy for carrying this fight and taking it to the Republican Senate and President. Those Republican senators, the people in their districts, ought to be speaking out. They were hoping, because a lot of this doesn't take effect till after the midterm elections, that the people would be unaware, that this wouldn't be challenged, and they would lose their benefits, but the midterms would already be passed. The American people are a lot more wiser than the president or Republican senators give them credit for.
Our next question is from James in Bloomfield, and he asks, why did you vote against the Republican continuing resolution that President Trump supported to keep government open?
Well, we voted against it um, because of all the reasons that I've stated before. We voted against this resolution because it hurts the American people, and it hurts people directly in the first congressional district, across the state of Connecticut, and all across this great nation. And we're going to continue to stand up to this president. Now, they don't need our votes, but when they ask about why we're voting this way, that's why we're voting this way. And that's why I'm proud of the Senate that's standing in the way and blocking them, because the American people deserve a lot better than losing their health care so that billionaires can have a tax cut.
Our next question comes from Anne Marie, who's joining us in Glastonbury. And she asks, what can Medicaid and WIC nutrition benefit recipients expect to happen during the government shutdown?
Well, thanks to the leadership of Governor Lamont, who I was with last evening at Pratt Whitney as we celebrated their 100th anniversary, the state of Connecticut will be using state funds to ensure that the WIC nutrition benefits continue for mothers, infants, and children. And that's what a lot of this is also that this administration has done while Trump claiming he's not going to touch Medicare or Medicaid, what he's done, or Social Security, is he's shifting the problem from the federal government to the states and no longer wants to be a partner with the states, but have that the states bear the burden themselves. No matter how you slice it, what he's doing is impacting cuts or tax increases by pulling away from and not funding the programs the way that they should. So we're introducing legislation that will reimburse states like Connecticut that step up and do the right thing when government reopens. And that's how government should operate, in a true partnership between municipal, state, and federal government, to basically assist the American people, the very people that we're sworn to serve, whether you're elected at a local level, a state level, or a federal level. We should all be pulling together on behalf of the American people. And that's what I'll continue to fight for in Washington, D.C.
Our next question comes from Christine in West Hartford. And she writes in saying, as a pediatrician, I want to thank you for continuing the fight for healthcare for everyone and for protecting the Affordable Care Act. What can you do to protect the civil rights of my transgender patients?
Well, again, all of your transgender patients, every human being needs to be protected under this system. And that's why we will continue to fight for and introduce legislation and stand up to this administration when it violates basic and essential human rights. Healthcare is a human right. It's essential. People cannot live without it. In fact, without it, they perish. We know this all too well. And that's also the grave concern for our people in hospitals and healthcare facilities as well, that the cutting off of government funding, that's bad. But what's worse is that the people who will suffer and who don't get the care and who ultimately will pass, and it will ultimately jeopardize everybody in the population because we simply didn't take care of the least amongst us. It doesn't make any sense. And that's what we'll continue to do. Fight on your behalf. We filed a brief for the Supreme Court, again, opposing state laws banning health care for transgender youth. And we will continue supporting state bans on uh, gay conversion therapy as well. Again, only the minds of an individual who is against common sense and human decency would prescribe alternatives like that. But that's the administration that we're dealing with.
Our next question comes from Karen in Rocky Hill. And she says, my husband and I are both in our 60s and getting ready to retire. Could President Trump take away future benefits from new Social Security recipients or reduce the payments we are already receiving?
Well, a very disturbing thing that they're doing. The short answer is they should not, because Social Security is a separate trust. But what concerns and should concern everyone is the fact that Elon Musk and Doge went into, now Doge is a term used for employees that were not vetted and have no accountability, and went into the Social Security Administration and perused through everyone's personal information and document. There was a court injunction, and I was proud that William Tong was able to join that stopped and blocked them from doing this. And then the Supreme Court ruled that they could go forward with this until the court case is solved. Now, that didn't make any sense at all. They should have been stopped from going forward until the court case was resolved. But because of that, Doge continued over the protest of Democrats to be able to go in and look at your personal information. And now they've taken it and placed it in an unsecure cloud, as they refer to it. And God knows what's happened. We continue to demand answers. You may recall that Elon Musk would not appear before the Ways and Means Committee. The Republicans refused to bring him or the Doge employees before Congress to answer why they needed to look at your personal information and why they violated this sacred trust. As I said then, and I'll say now, it's because they're out to privatize Social Security. Why? Because even for a person who makes $500 billion like Elon Musk, when you have a trust fund that has $2,700,000,000,000 of the people's money in it, that's where they have their greedy eyes. We will continue to stand up and fight against them, but every American ought to be aware that this is what they're doing. They're trying to dismantle Social Security from within, witnessed by the number of people they've laid off, the number of regional offices that they've closed, the ineffective phone services, so that they can say that, well, Social Security is ineffective. And we've got a better plan. And we're going to use AI to make sure that you get a better deal than what the existing Social Security is. As my grandfather Nolan would say, trust everyone, but cut the cards. And in the case of this administration, we not only need to cut the cards, we need a reshuffle in a new deal that outlines and stays with and sticks to Social Security remaining a separate entity, not its money being devoured by Wall Street and entrepreneurs so that they can take the profit out of Social Security and line their own pockets instead of having it work on behalf of the people as Roosevelt intended it to do. Congress must stand up. We've got legislation that will do that, that will act and expand Social Security and make sure that it's there for future generations as well, but making sure that existing Social Security is not only secure, but enhanced for every individual. More than 300 million people are covered by Social Security, and 70 million people currently are receiving Social Security benefits. They're not getting what they're entitled to, and that's simply because Congress hasn't acted responsibly like it should, like my bill requires Congress to do. And that's what I'm fighting for down in Washington, D.C.
We have time for one more question tonight, and it comes from Barry, who's joining us from Glastonbury. And he asks, do you think that Affordable Care Act tax credits should be extended permanently? Why are you fighting to extend them now?
Yes, I think that it only makes common sense that they should be made permanent. And because they go directly to helping out the American people, and it goes directly to helping out our healthcare system in general. And so people utilize these healthcare credits, and when they do, they're able to see their doctors and their nurses and their clinics on a regular basis. And so it becomes preventative in its very nature. And by that also meaning that we'll have a healthier, better informed society, which means less costs for all Americans and greater health. Health, as we said earlier, is an individual right. It's something that every individual, and certainly every American citizen, is entitled to. It should be that simple and that straightforward, because it only takes common sense, especially going through what we've witnessed with global pandemics and the spread of disease, and having a country that's prepared for that, that can provide the, you know, appropriate immune system shots that are going to be required to have access to the healthcare officials to lead a healthy, sustainable life is the way that we ought to go. I am appalled by Robert Kennedy's call for the end of vaccinations in critical areas. That is non-scientific, not supported by healthcare officials, and is totally absurd and detrimental. And when you look at the prospect of what's going on with this government under the Trump administration, from healthcare to the militarization of our military, to going through everyone's personal records and Social Security in an attempt to privatize it, American citizens and American people are much smarter than this president wants to give them credit. The midterm elections are going to be extraordinarily important to providing where if the Republicans will not stand up to this president, then elect the people who will and make a difference in the United States Congress and be a check on this abusive, authoritarian government that is run by Donald Trump. Thank you for joining us this evening. Thank you for the questions that you've had. These are questions that we hear at most of the town halls that we conduct as well. And we will continue to, as we get new information about programs that are coming forward and how we're reacting and acting and continuing to fight against this administration. We want to make sure that we keep our citizens informed. And as always, as I said at the beginning, everybody still has to exist during these times. And if you have a question or a concern or a need, you're not alone. Call our office, 860-278-8888. We're there, we're here to serve you and help you. Thank you.